Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock. Today's program, we're going to be talking about pharmacy and medications. With me, I have Linda Radke. Linda is the clinical coordinator for the pharmacy department at Salina Regional Health Center. Thanks for being on the show. I think start out, let us know, what is the role of pharmacy at Salina Regional or at hospitals?
Really proud of our group of pharmacists and pharmacy technicians at Salina Regional. We have pharmacists in the critical care area, the emergency department, internal med, cardiology. The pharmacists are on the floors working with the nurses and the pharmacists, and we're all about providing safe and effective drug therapy for our patients.
Okay, you mentioned safe. I mean, that's one thing that's obviously it's mentioned a lot, nationally in news and stuff is talking about safety in hospitals, and that's something obviously is a concern of you, correct?
Yes, one of my responsibilities at the hospital is to look for things that we can prevent. What are preventable medication problems? And so we actually look at patients that are coming into the hospital and see if the reason that brought them to the hospital was that something went wrong with their medication.
I think that's one thing as drugs increase, as we look at for alternative ways of combating illnesses. One thing is with medications, but there are so many out there. I mean, how do you work as far as keeping those straight?
Well, you can imagine if as a pharmacist it's difficult for me that what it is for the average patient who may be on many medications that may interact with each other and may have side effects that are duplicated because of the different medications. So we look at every patient that comes into the hospital. Within 24 hours, a pharmacist has reviewed their home therapy to make sure that what the list said is what they're really taking, because garbage in equals garbage out. And a lot of times the information that's in the computer may be a couple of years old and they're not on any of those meds anymore. They have new ones or the doses have changed. So we have a pharmacy technician or a pharmacist go in and interview the patient and find out, double check with the pharmacies, with the clinics, the family, and make sure that the medication list that we believe the patient taking really is accurate. Non-adherence is a big problem. Patients may get those prescriptions filled, but they're not necessarily taking them the way the physician thought they were.
Thank you very much. Thanks for being on the show. Thank you for watching. For more information on this or other medical topics, please visit srhc.com, like us on Facebook, and follow us on Twitter. Thank you.